Upper blepharoplasty in Asians is what we call also a accidental blepharoplasty. And the goal of an accidental blepharoplasty is not to make the eyes look more youthful, but to define and accentuate the eyes itself. And so obviously these are more reserved for younger people. The goal is to make what we call a supertarsal fold, which is the crease on the upper part of the upper eyelid. There's two general ways to define the supertarsal fold. The first is what we call a suture technique, where instead of making incisions, we utilize sutures to create the crease where we want it. The second method is what we call an open upper blepharoplasty, where we make a full incision across the area where we want to define the supertarsal fold. For the suture technique, the advantages is that the recovery time tends to be quicker. For a lot of people, because it's a suture technique, that there is no scar that's visible on the outside, and everything is performed from underneath the upper eyelid area, so there is no visible scar. The downside is that there is a higher recurrence rate for loosening of the supertarsal fold as time goes by, and so some people, they require revisional surgery sometime in the future. The open technique is where the incision is made across the supertarsal fold, and it's usually for people that requires, in addition to excision of the skin, also to remove some of the fullness in the upper eyelid, such as the fat, and then create the fold. This tends to be a little bit more secure in that the recurrence rate for loss of the supertarsal fold is very low. However, more recovery time is needed.